Ativan, also known as Lorazepam, is a medication used to treat anxiety. It belongs to a class of drugs called benzodiazepines, which work on the brain and nerves to produce a calming effect. Ativan works by enhancing the effects of a certain natural chemical in the body called GABA. It is important to take Ativan exactly as prescribed by your doctor. The typical dosage for anxiety is 1 to 2 milligrams taken 2 to 3 times a day. It's best to take Ativan at the same times each day to help you remember. Always follow your doctor's instructions for the best results. Make sure to read the medication guide provided by your pharmacist before you start taking Ativan and each time you get a refill. If you have any questions, ask your doctor or pharmacist. Take Ativan by mouth with or without food as directed by your doctor. The dosage is based on your medical condition, age, and response to treatment. If directed by your doctor, use Ativan regularly in order to get the most benefit from it. To help you remember, use it at the same times each day. Do not suddenly stop using Ativan without consulting your doctor. Some conditions may become worse when this drug is abruptly stopped. Your dose may need to be gradually decreased. When Ativan is used for a long time, it may not work as well. Talk with your doctor if this medication stops working well. Though it helps many people, Ativan may sometimes cause addiction. This risk may be higher if you have a substance use disorder, such as overuse of or addiction to drugs/alcohol. Take this medication exactly as prescribed to lower the risk of addiction. Ask your doctor or pharmacist for more details. Tell your doctor if your condition lasts or gets worse. Some common side effects of Ativan include drowsiness, dizziness, loss of coordination, headache, nausea, blurred vision, change in sexual interest/ability, constipation, heartburn, or change in appetite. These effects may occur, but many people using this medication do not experience serious side effects. It's important to remember that your doctor has prescribed this medication because they believe the benefit to you is greater than the risk of side effects. However, if you experience any serious side effects such as mental/mood changes, trouble speaking, vision changes, unusual weakness, or signs of infection, it's important to tell your doctor right away. In rare cases, Ativan may have the opposite of its usual calming effect, which can include symptoms such as agitation, irritability, violent behavior, confusion, restlessness, excitement, and talking more than normal. If you notice any of these effects, it's important to contact your doctor immediately. While a serious allergic reaction to Ativan is rare, it's important to seek medical help right away if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed here, be sure to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Lorazepam, also known as Ativan, is a medication that can be helpful but also has some risks. It's important to take it exactly as prescribed by your doctor, and to be aware of potential side effects. It's also important to know that suddenly stopping this medication can cause serious withdrawal symptoms, so your doctor may need to lower your dose slowly if you need to stop taking it. If you experience any unusual symptoms while taking Ativan, it's important to seek medical help right away. Remember, Ativan should only be taken as prescribed by your doctor, and it's important to follow their instructions closely. Before taking Ativan, it's important to inform your doctor or pharmacist if you have any allergies, especially to benzodiazepines, or if you have any other medical conditions such as kidney or liver disease, glaucoma, breathing problems, mental disorders, or a history of substance use disorder. Ativan may cause dizziness, drowsiness, or blurred vision, and using alcohol or marijuana can increase these effects. It's important to avoid driving, using machinery, or doing anything that requires alertness or clear vision until you know how Ativan affects you. If you are an older adult, you may be more sensitive to the side effects of Ativan, especially loss of coordination and drowsiness, which can increase the risk of falling. It's also important to note that Ativan may have the opposite effect in older adults, causing restlessness or mental/mood changes. In children, Ativan may also have the opposite effect, causing restlessness, shaking, or mood changes. If you are pregnant, plan to become pregnant, or are breastfeeding, it's important to consult with your doctor before using Ativan, as it may harm an unborn baby and can pass into breast milk. It's important to be aware of potential interactions with other medications when taking Ativan. This includes both prescription and non-prescription drugs, as well as herbal products. Always keep a list of all the products you use and share it with your doctor and pharmacist. Some products that may interact with Ativan include clozapine, GABA, and sodium oxybate. The risk of serious side effects, such as slow or shallow breathing, may be increased if Ativan is taken with other products that may also cause drowsiness or breathing problems. These can include opioid pain or cough relievers, alcohol, marijuana, other drugs for sleep or anxiety, muscle relaxants, and antihistamines. It's also important to check the labels on all your medicines, such as allergy or cough and cold products, as they may contain ingredients that cause drowsiness. Always ask your pharmacist about using these products safely. Remember to never start, stop, or change the dosage of any medicines without your doctor's approval. If you suspect someone has overdosed on Ativan and they are experiencing severe symptoms such as passing out or difficulty breathing, it is important to seek emergency medical assistance by calling 911. In less severe cases, contacting a poison control center is recommended. In the U.S., you can reach out to your local poison control center at 1-800-222-1222. Canadian residents should contact their provincial poison control center. Symptoms of an Ativan overdose may include confusion, slow reflexes, clumsiness, deep sleep, and loss of consciousness. If you suspect an overdose, it is crucial to seek medical help immediately. If you are looking to increase the effectiveness of Ativan, consider starting a stress reduction program. It's important to talk to your doctor or pharmacist about lifestyle changes that could benefit you. Remember not to share Ativan with others, as it is against the law. While taking this medication, it's essential to undergo lab and medical tests, such as blood counts and liver function tests. Make sure to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose and usually take it more than once a day, don't take the missed dose if it's almost time for your next scheduled dose. Just skip the missed dose and take the next one as usual. Don't take a double dose to make up for the missed one. If you normally take Ativan once a day at bedtime and miss a dose, don't take it the next morning. Instead, contact your doctor to figure out the best course of action. Remember to store Ativan at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When it comes to disposing of Ativan, make sure not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. If you have any questions about how to dispose of Ativan, consult your pharmacist or local waste disposal company for proper guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.